What is tetanus? Tetanus is a serious disease of the nervous system caused by a toxin-producing bacterium. The disease causes muscle contractions, particularly of your jaw and neck muscles. Tetanus is commonly known as lockjaw. Severe complications of tetanus can be life-threatening. There's no cure for tetanus. Treatment focuses on managing symptoms and complications until the effects of the tetanus toxin resolve. Because of the widespread use of vaccines, cases of tetanus are rare in the United States and other parts of the developed world. The disease remains a threat to people who aren't up to date on their vaccinations. It's more common in developing countries. What are the symptoms of tetanus? The average time from infection to appearance of signs and symptoms incubation period is 10 days. The incubation period can range from 3 to 21 days. The most common type of tetanus is called generalized tetanus. Signs and symptoms begin gradually and then progressively worsen over 2 weeks. They usually start at the jaw and progress downward on the body. Signs and symptoms of generalized tetanus include: tetanus is a serious disease that causes painful muscle spasms and stiffness. It often starts with the jaw, making it hard to open your mouth, a condition called lockjaw. The muscles around your lips can tense up, sometimes causing a constant grin. Your neck muscles can become very stiff and painful, making it hard to move your head, and swallowing can be difficult. Your abdominal muscles might also become hard and painful. As tetanus progresses, you may experience repeated painful spasms lasting several minutes. These spasms can cause your neck and back to arch, your legs to become stiff, and your arms to draw up with clenched fists. Muscle stiffness in your neck and abdomen can make breathing difficult. Even minor events like a loud sound, a touch, a draft, or light can trigger these severe spasms. As the disease progresses, other signs and symptoms may include: tetanus can also affect your body's autonomic functions, causing various symptoms. You might experience high blood pressure or, in some cases, low blood pressure. Your heart rate can become rapid, leading to a fast pulse. Fever is another common symptom, and you may also suffer from extreme sweating. These signs indicate that tetanus is impacting more than just your muscles, affecting your overall bodily functions. Possible complications. Complications that may result from tetanus include: tetanus can lead to a range of serious complications affecting different parts of the body. These include potential airway obstruction, where the passage for breathing may become blocked, and respiratory arrest, a condition where breathing stops altogether. Additionally, the disease can contribute to heart failure, impairing the heart's ability to pump blood effectively. Pneumonia, a lung infection, is another possible consequence. Tetanus can also cause damage to muscles, resulting in weakness and dysfunction, along with the risk of fractures due to severe muscle spasms. Furthermore, the lack of oxygen during spasms can lead to brain damage, compounding the severity of the condition. These complications underscore the significant impact tetanus can have on overall health and functioning. What are the causes of tetanus? Bacteria called Clostridium tetani cause tetanus. Spores of the bacteria can be found in dust, dirt, and animal droppings. Spores are small reproductive bodies produced by certain organisms. They're often resistant to harsh environmental conditions, such as high heat. A person can become infected when these spores enter the bloodstream through a cut or deep wound. The bacteria spores then spread to the central nervous system and produce a toxin called tetanospasmin. This toxin is a poison that blocks the nerve signals from your spinal cord to your muscles. This can lead to severe muscle spasms. Tetanus infection can be linked to various types of injuries and wounds. These include crush injuries, wounds with dead tissue, burns and puncture wounds from activities like piercing, tattooing, or stepping on a nail. Additionally, tetanus can result from wounds contaminated with dirt, feces, or saliva. Less frequently, it's associated with animal bites, dental infections, insect bites, or chronic sores. Importantly, tetanus isn't contagious from person to person. It's a global concern, but tends to be more prevalent in hot, damp climates with fertile soil and in densely populated areas. How it's diagnosed? Your doctor will perform a physical exam to check for symptoms of tetanus, such as muscle stiffness and painful spasms. Unlike many other diseases, tetanus is not generally diagnosed through laboratory tests. However, your doctor may still perform lab tests to help rule out diseases with similar symptoms. These include meningitis, a bacterial infection that affects the brain and spinal cord, or rabies, a viral infection that causes brain swelling. Your doctor will also base a tetanus diagnosis on your immunization history. You're at a higher risk of tetanus if you haven't been immunized or if you're overdue for a booster shot. How tetanus is treated. When someone is diagnosed with tetanus, what does their treatment typically involve? Treatment mainly revolves around managing complications until the effects of the tetanus toxin subside. This usually takes place in a hospital setting, often in the intensive care unit. Doctors typically administer antibiotics to combat the bacteria causing the infection and tetanus immune globulin TIG to neutralize the toxin already released. Additionally, medications may be prescribed to control muscle spasms, and supportive therapy may be necessary to maintain vital bodily functions. Depending on the severity of the infection, individuals might require assistance with breathing and may be placed on a ventilator.